Dr. Isaac Bogoch is an infectious disease physician at the Toronto General Hospital. We've reached him tonight in Côte d'Ivoire in Africa. Dr. Bogoch, first of all, thanks for taking time to take my call. I appreciate it.
Oh, not a problem.
As you watch how the response has rolled out in this country, how satisfied are you so far that public health officials in Canada are doing and saying all the right things here?
Well, I think certainly at the federal level, we've had very good messaging and transparency from our Chief Public Health Officer, Dr. Theresa Tam. And we, had a plan in place, and this was communicated to the Canadian public. At the provincial level, where really the rubber hits the road, where we've got policy that truly affects individuals, because that's how healthcare is really guided in Canada. It's been variable across the provinces, and some provinces I think have been more communicative than others. I think many provinces should follow the lead of British Columbia, where they've had very frequent updates and a lot of transparency over diagnostic testing and rollout of testing and where to go for help. So British Columbia, I think, has done the best that I can see so far.
We see the cases creeping up sort of day by day. Does that tell us that what we're doing is working, that we kind of have it under control, or is it just a matter of time before the cases increase much more rapidly and we start seeing bigger numbers every day?
Unfortunately, I think it's the latter. This is not unexpected. We know that we're not able to wall off the country. We know cases were going to come into Canada. And as this infection creeps around the entire world and the global burden gets bigger, we're just going to see more and more imported cases into Canada. And then, of course, we're going to start to see locally acquired cases, which we've already seen one in British Columbia. And, of course, we'll very likely see many more of those to come in the weeks and months ahead. The key thing here is to mitigate how steep the curve is, how steep the rise in cases is in Canada. I mean, there's things that we can do to flatten out that steep curve by social distancing and maybe working from home or spreading out a little bit more and practicing impeccable hand hygiene. And these are things that we can do to sort of lessen the epidemic curve. And if we do that, hopefully our system will be able to manage the influx of cases that we're going to see.
Right. That's advice to Canadians on as we watch where this outbreak might take us. But does it argue for greater restrictions coming from the government on the movement of people in our communities, restrictions on large gatherings, as we've seen implemented in other countries, as opposed to advice? Is it time for actual government policy?
Yeah, I mean, certainly that I think all cards are on the table. And I think those should be very real discussions that we have. Are we there right now in Canada where it's time to do it? Maybe, but maybe it's a little bit too early. But I mean, everyone should be having the conversation. So schools and employers and anyone who works in a building with lots of people, these are conversations that they should be having about preparing for the next few weeks to months ahead, because no one really has a crystal ball, but we have to be prepared. And certainly strategies where people might be able to work from home, or strategies where maybe stadiums aren't sold out to capacity, but they sell half the seats or some fraction of the seats, or maybe there'll be some cancellations of large gatherings. These are things that we can do to sort of mitigate transmission of this infection in the community. And we've seen it successfully employed, maybe not to the same extent as in China, but places like Japan and South Korea have done this quite successfully there.
The Health Minister, Patty Hajdu, says some provinces have indicated they don't have all the supplies they might need to respond to the COVID-19 outbreak, ventilators, perhaps other key pieces of medical equipment, and that the federal government is working now to have the provinces identify those gaps in looking at bulk buying, and so that everybody can be ready for this. And I guess I'm wondering, are you surprised to hear that there are these gaps and supply issues when, I think it's fair to say that medical professionals such as yourself, were we not expecting some kind of an outbreak such as this at some point? And are we as prepared as we should have been?
Yeah, I mean, after SARS, for example, there was a big call to make sure that we had capacity in the hospitals and in intensive care units and had the right ventilators. So I think it will be a rude awakening if we are not prepared, given our experience with SARS and the lessons that we should have learned from this. Now, there certainly are lessons that were learned from SARS that we're seeing now. I mean, I think our public health infrastructure to date has managed this beautifully. I mean, we've identified lots of cases. We've ruled in and ruled out lots of cases. We've massively scaled up diagnostic capacity. Right now, what's happening is in the next 0 to 2 weeks, you're going to see dedicated COVID-19 clinics popping up across the country, so we reduce the burden in emergency departments and in hospitals. So, things are happening, like tangible, helpful things are happening. But of course, sadly, a small proportion of people will get sick and require hospitalization. A small proportion of those people will require an intensive care unit, and sadly, a small proportion of those people will succumb to this illness. But if there's an absolute large number of individuals that get sick quickly, there's the potential that we might not have the resources necessary, and that would be tragic. Now, China's massive public health endeavors really gave the world about 2 months to prepare. I hope we use those 2 months wisely.
All right, Dr. Bogoch, thanks so much for your time. Always good to get your perspective. Appreciate it.
And anytime. Have a good one.